Good. Good morning, everyone, and a really warm welcome. Thank you for joining our webinar. Thank you for joining us. I realise that we're competing with the sunshine outside, so I really appreciate your time. My name is Lucy Griffiths. I'm based at Swansea University, and I'll be your chair for today's session. Together with Karen Broadhurst, I co-lead our ADR Community Catalyst Children at Risk of Poor Outcomes project. So the project aims to build a community of researchers and analysts focused on children and young people supported by early intervention services, or children's social care in the UK. And at the beginning of this year, we published a research agenda, which included key recommendations and priorities based on a scoping review of the evidence and stakeholder consultation. And one of the topics highlighted as a pressing area for the research community included household level hardship. So today we will therefore be discussing and showcasing use of administrative data to better understand household deprivation and its impact on children and families. So we're lucky to have 4 speakers lined up. Dr. Polly Vizard from London School of Economics and Political Science, Professor Rick Hood from Kingston University, and then a joint presentation from Andrew Needham and Mike Daly from the Department for Work and Pensions. I'd like to encourage you to ask questions via the Q&A function, and we will respond to as many of these both verbally during the webinar or following the webinar. We'll also be recording today's session, so don't worry if you miss anything. So let's get started. I'd like to hand over first to Polly, who will speak on the strengths and limitations of linked population census of administrative data. Thank you, Polly.
Thank you, and thanks for the invitation. Thank you. Next slide, please, Grace. Yeah, if people could just, note the data acknowledgement and disclaimer for secure data. Thank you. Next slide. So yes, as we just heard, we're focusing today on the challenge of how we can build up a stronger evidence base on the relationship between household hardship and involvement with children's social care. And this topic has kind of risen up the research agenda as a result of the Children at Risk of Poor Outcomes stakeholder consultation and scoping review. It's also something we've been looking at in the Children's Information Project, which is a project I'm working on at the moment that aims to improve the use of voice and data information within local services. We do, of course, have a small but important body of literature already on child welfare inequalities, but that literature has typically been limited in the past by data infrastructural limitations. In particular, the identifiers of socio-economic disadvantage that have typically been used have been reliable and valid at the level of small areas rather than being reliable and valid at the level of individual households. So today we're looking at how novel data developments, linkages, new administrative data can help to improve that data infrastructure. I'm focusing on the strengths and limitations of linked population census data, and others are then going to look at tax and benefit and local government data on financial precarity. The essential point being that within current children's social care administrative data that's centrally available, we don't have high quality information on child's household contacts and circumstances. So how can data linkages improve that? Thanks. Next slide. So it's worth pausing for a moment and just thinking about the concepts and measures of deprivation and disadvantage that are available in poverty research and that have been used. And I think it's useful to broadly distinguish between 4 types of indicators that aim to directly capture a person or a household's position in a social hierarchy, such as social class or the NS-SEC occupational scale. Then we have another set of indicators that aim to capture deprivation specifically in living standards, so indicators absolute or relative low income or poverty. We also have material deprivation indices that aim to capture a broader set of deprivations in a broad set of material resources, that material things that can and can't be afforded, We have measures that aim to measure persistence of disadvantage and deprivation, persistence of low income, and others that aim to look at extreme disadvantage, so measures of destitution, inability to afford essentials, food and shelter and so forth. Another set of indicators don't so measure directly identify that deprivation in living standards, but rather predict it. So predictors that are used might include, for example, those measures of social class and occupational group, unemployment, economic activity, educational disadvantage, capital assets that the person has, their debts or arrears, or their group membership, for example, being lone parents or having a disability. And then a fourth set of indicators, which perhaps are a bit newer, aim to capture multidimensional deprivation. So, for example, the multidimensional poverty index, these are indicators of simultaneous deprivation across multiple critical life domains. So looking at living standards, but also deprivations in health, education, and indeed participation, relationships, and so forth. And their cumulative advantage, the way those deprivations accumulate and interact for individuals, so a multiple deprivation count. Thank you. Next slide. So indicators of disadvantage and deprivation that are typically included in administrative data sets. Well, free school meals indicators have for a long time been included in education administrative data, although they're being critiqued at the moment. Within local government data, I think we're hearing later, there's sometimes available indicators of household stress, financial precarity, or housing or benefit arrears or housing and council tax arrears or service and benefit eligibility. And we also have new increasingly data sets from DWP and HMRC, as we're also going to be hearing about, which include important information on benefits and taxation. Administrative data set linkages can help where those identifiers are missing within a particular data set, such as children's social care data. So in the past, we've had linkages of education and children's social care data, which make available the free school meals identifier. We also have new linkages becoming available involving that DWP and HMRC data. For example, new developments with the pupil-parent matched data set in education, and other data sets such as LEO beginning to make use of some of that data, and some of it aspiring to be more real time. We've also had indicators of multiple deprivation that are matched into administrative data sets quite widely. The index of multiple deprivation and index of deprivation impacting on children. These are multiple deprivation indicators, so they look beyond living standards to some of those other critical life domains. But they are typically available at the small area level and haven't in the past been valid and reliable at the level of individual households. So overall, we have a picture of indicators that are household or individual level, but are often unidimensional or multidimensional, but area level. Thank you. Next slide, please. So in terms of the search for improved and additional identifiers, one place we might look is population census data and to linkages of that data. So there's two immediate limitations. The census only takes place every 10 years, so it's in essence a snapshot of the population. Household deprivation itself, of course, is one of the outcomes that we'd really like real-time information on and can change rapidly. So last census 2021 wouldn't pick up current living standard squeeze. This snapshot design might be a particular concern for some subgroups. For example, family composition might change over time, new families formed or family breakdown, ethnic and gender identification can change, and children can move households. So this might be a concern for some particular subgroups as a source of bias. children involved in the care system and children's social care may have those particular biases. Also, the census doesn't include a household income variable, though there's a clear user requirement for that, and there was a lot of discussion around that in the run-up to the 2021 census, and I do believe ONS is creating a methodology for modelling household income and attributing the households in the 2021 census a modelled household income variable based on admin income, taxation and benefit data. So other strengths that are with population census data, a large number of those indicators that I was talking about before are included. And also ONS provide 4 derived household deprivation indicators. These look across employment, education, housing, and health and disability deprivation. These have been widely used by the ONS in their census analysis in the past. They are intended to be valid and reliable at the household level, and they do provide a deprivation count. Thank you. Next slide. So I've just put on here some of the contributions to a really rich tradition of using population census data to derive indicators of disadvantage and deprivation that we might build on. These are some of the main references for people that are interested, and you can look at it in due course. But these exercises are all at the area level. They've been attempts to create new indices that are new area level indicators. Thanks. Next slide, please. So in contrast, what we've been trying to do with the Growing Up in England data set is really look at proof of concept for linking to longitudinal administrative data from education and children's social care system to the kind of household information on context and circumstances, and to develop indicators that are reliable and valid at the household level. So just to give you a bit of background information, GUI links census data to administrative data from the education and children's social care system. The linkage was a response to the identified need for a new data set focusing on highly vulnerable and disadvantaged children and young people. It was created as a collaboration between ONS, DV and ADR in specific response to data gaps highlighted by the Children's Commissioner for England. The value added of it was seen very much as linking longitudinal admin data where information on household context and circumstances isn't recorded to that information that's recorded in the population census. The GUI build itself has certain limitations. One is its time window, so it's focusing on census 2011, and the longitudinal educational social care data only goes up to 2014-15. So it's still very good for methods and retrospective studies, but it's less policy relevant. The census data that was supplied with it was much more limited than some of us anticipated. So we get the individual records of linked child data subjects and information about their household. But we didn't receive in Wave 1 GUI the individual records of other family and household members, including parents and carers. That is really critical that is delivered going forward. So that's limited what we can do with the data set in terms of deprivation and analysis and new indices. There's also been some issues with Wave 3 delivery and the children's social care data, which I can answer questions on if people are interested. It has various information gaps. So in kind of headline is we're thinking of this as an experimental data set, and the findings from it are experimental. Next slide, please. So we were one of the first projects of external researchers to ONS that got to use this data set, and we undertook a kind of proof of concept project, which was funded by ADR. It was a partnership with Friends, Families and Travellers, and the co-I is Polina Oblenskaya. And we had a particular focus on the value added population census linked administrative data in opening up new research opportunities to build up quantitative longitudinal evidence on the lives and experiences and support needs of Gypsy, Traveller and Roma children and young people at scale, whereas previously there'd been a dependence on qualitative research and small-scale studies. Next slide, please. So just briefly to mention some of the findings. These findings have been important in really building up quite granular evidence on the scale of the challenges facing Gypsy, Traveller and Roma children and young people as they grow up. So we use the identifiers from across the census and the education system to identify our analysis samples, and using the census data that's available, we provided evidence that children identified as Gypsy, Traveller and Roma are substantially more likely to be living in single parent families, a family with 3 or more dependent children, to report bad health or disability themselves, or to live in private rented accommodation or overcrowded accommodation, as well as in a caravan or other mobile structure. The results in terms of household multiple deprivation, what's showing on the screen now. So we focused on a cohort of young people who were aged 14 and 15 on Census Day 2011 and looked at their household multiple deprivation characteristics. So because of the supply issues that I just mentioned, we couldn't kind of develop our own household level deprivation indicators from scratch using household members' individual records. So we were dependent on the ONS derived indicators. Nevertheless, I think that the results have been really important. For example, putting a spotlight on the extent of household educational deprivation amongst Gypsy and Traveller and Roma young people, with very high proportions growing up in households where they have no, lack of educational social capital and no one with a qualification in the household at level 2 or above. So that finding is on the left and on the right, you can see the household deprivation count and very small proportion of Gypsy, Traveller and Roma young people who aren't living in households that are not deprived in any dimension, and how those deprivations at the household level mount up. Next slide, please. So the aim is to go on and to kind of follow those young people. And so far we've looked at the Wave 1 data, particularly looking at educational qualifications obtained by academic year the young people in the cohort turned 19, so kind of 4 years later from what you just saw. And these results have been really important in putting the spotlight on the extent of the intergenerational transmission of household education deprivation, with 59% of Gypsy Traveller young people in educationally deprived households then not going on to obtain a level 2 qualification by the time they turn 19. That's the finding on the left, and on the right you can see the percentage not obtaining level 2 for all young people, kind of increasing in the number of deprivations in the deprivation count. Thanks. Next slide. So we haven't ourselves looked at the children's social care data yet. That's what we're hoping to do next. But the ONS had early access to the Wave 2 data. So they have published a study using the GUI Wave 2 data and linking it to census information on household deprivation. So what they've done is isolate as best as they can with the Wave 2 data. So historic children's social care data wasn't available, but as best as they can, they identified young people who entered care for the first time after Census Day 2011 and up to 2014-15. The children they looked at are 10 years old and above, up to 17, because of the way that GUI is designed. But in terms of proof of concept, they have been able to link that information to census derived indicators, again looking at education by dimension and the household deprivation count. Thanks. Next slide, please. So just to make you aware of some of the ongoing developments in that research, I believe ONS are expanding that analysis. There's a small group of ADR fellows and PhDs who are using the GUI-linked data in various ways. We're hoping to expand our Gypsy Traveller and Roma and study, and also as part of the Children's Information Project to look at a new index and to trial that with the Wave 2 and Wave 3 data that is now released, although there are some issues with the delivery of the historical children's social care data in GUI. So if anyone plans to use it, I can answer questions on that. Next slide, please. So to sum up, in terms of the strengths and limitations of population census and linked administrative data, I think the GUI kind of experiment, example, proof of concept establishes that population census data can usefully be linked to administrative, education and social care data. We can use the census data to identify households with multiple deprivations and support needs. And with careful attention to sequencing and time windows, the information can be used to address evidence gaps and provide new insights. We do have the inherent limitations of population census data in terms of it being a snapshot and not having an income variable. There's various limitations of the GUI bills, and then there's other inherent limitations of children's social care, administrative data, including lack of information on early help, for example, which this method wouldn't overcome. Next slide, please. Looking forward to 2021 population census administrative data linkages, there's some really interesting and rapid developments going on. We have some new linkages that ADR that have made available to the family court and CAFCAS data and to the nursing and midwifery register. ONS, as I mentioned, they are developing methods for modelled household income information to be made available with the 2021 census. I very much hope that would be included in research data sets going forward. There's also the longitudinal population data set, which is being developed within ONS as an asset, and NHS numbers have been assigned to Census 2021 records, and some health analysis have been undertaken. So that's all really exciting. Obviously, our ask is a really high quality linkage of population census data to education, health and social care administrative data as soon as possible to be in the SRS. That ought to have the household model information in. But in terms of the GUI lessons, three kind of takeaways for anybody working on this or taking it forward with ONS. First, it's really essential to link those individual records of all household members, not to have a more limited supply, because it really restricts what can be done. Secondly, if we're thinking of a data set on seldom heard groups, they are also hard to link population groups, and it would be really important to see some bespoke exercises to try and improve their matching success rates. So the residuals analysis we did with Gypsy Traveller and Roma young people showed that they were, even where their records were available in education data, they're being linked in at lower rates. So it'd be really good to have kind of dedicated exercises, similar problems if children are missing from education data. So really working on improving those matching rates for seldom heard groups and making their representation more proportionate. And then finally, there are some data owner census rules around sub-local authority analysis that I think need to be looked at. For example, with GUI, we weren't able to have a pseudo identifier of schools within a data set because of this approach to disclosure. So I think it'd be really important for the new linkages to be kind of looking at those rules and what can be done that's not disclosive. Thank you.
That was fantastic. Thank you, Polly, for setting the context as well so well. We have a question in the Q&A box from Tammy. Could you say more about the plans and strategy to combine 4 other indicators with FSM, please?
Yes, so we're still going to be restricted by the wave 1 supply that's in GUI, so we won't be able to go back to the individual records. But what we thought would be interesting would be to combine the ONS household level deprivation indicators with free school meals, and we've had that approved. Seeing how free school meal status correlates with the other deprivation indicators and value added of bringing that information together. Thanks, Tammy.
Perfect, thank you. I was just wondering also whether you could expand a little bit more on the problems that you suggested that we have with the children's social care data in GUI.
Yes, so at the moment, there appears to be a problem with the wave 3 supply. So wave 2 was should have covered 2010-11 to 2014-15, and my impression is it is as it should be. But the wave 3 data should have gone back as far as data allows, back to kind of the beginning of GUI, which would be 2001-2. So it wouldn't go back that far, but it should be the complete run of the back series of the looked after children and the children in need census. So both of those data sets should be there, but there appears to be a problem in the wave cover in the year coverage. So a couple of us have noticed that and have asked ONS to have another look at that and get back to us to understand more about the year coverage and why it doesn't appear to be the historical information. Obviously, it's really critical for individual care histories, individual social care histories, that we have that historical information, so we can look at prior involvement and history of involvement as well as current involvement. The wave 2 study that ONS did made good use of the wave 2 data, but I think expanding that needs the wave 3 data. So it's really important that if there is a problem with that supply, that it's reissued, and I think that will make the data set much more useful to a wide range of people. So that's what we're hoping will happen.
Brilliant. Thank you, Polly. I think there's one more question in the Q&A, so I'd be grateful if you could just respond to that whilst we move on to Rick now, please.
Okay, thank you.
Brilliant. Thanks, Rick. And lastly, I'd like to hand over to our DWP colleagues now, please, Andrew and Mike, who will introduce us to RAPID and its potential for providing valuable insights into children and families. Thank you.
Thank you very much. Excuse me. I'm going to start off with some talking through the introductory slides before handing over to Andrew, who, as the principal creator of RAPID, is the person who actually knows all about it and knows what he's talking about. So if you could move on to the next slide, please. So that's just a brief word cloud showing the sorts of things that RAPID is starting to influence. We created the data set initially in DWP, just starting from the point of view it would be a good thing to have. And over the last year, and actually particularly over the last few months, the interest in it has grown enormously to influence a lot of different debates. So you can move on to the next slide, please. So what we're going to cover is something about the DWP context, which is going to be my bit, before handing over to Andrew to talk about how RAPID has been created and its strengths and limitations, and to present a range of results about the data. So you move on to the next slide, please. So I just wanted to give just a bit of context about DWP and the sorts of things we're interested in. I think it's useful context, but it's also always particularly good to get this in front of researchers to give some ideas about the sorts of evidence questions we are interested in. So these are our 5 goals of the Secretary of State, which are probably the most concise way of saying what we are all about. So it's about work, it's about poverty, and particularly child poverty. It's about the pension system. It's about equality and independence for a range of groups, including disabled people. But also we have a strong interest in making sure that we deliver our services efficiently and to a high quality standard. So you could move on to the next slide, please. And this is just an overview of RAPID, where we are essentially taking together all the data we have, which is directly indexed by national insurance number. So the RAPID stands for Registration and Population Interactions Data Set. And interactions that we currently have are a range of demographic information. We have employment, including self-employment, and also included within the employment information, we have student loans, a whole range of benefit interactions. For some benefits in some households, we have household links. That's primarily where the benefit is based on the household rather than individual. Some things about the nature of people's disability. We know about occupational personal pensions that are in payment through the PAYE system. And something that's of interest to a lot of people is we have information on people's migrant status. So you can move on to the next slide, please. So this is about our plans which bring us here today, which is we have got all the approvals in place to make RAPID available through the Secure Research Service with the support of ADR UK. We and HMRC are working with ADR and ONS to make the data available early in 2025. And I appreciate that early. I think when we originally started saying this, we might have thought even a little bit earlier. So we have no firm date yet. The Secure Research Service will hold everything that's available. It'll cover the whole of the UK and run from 2008, 2009 tax year onwards. Initially, what we will have is RAPID as a standalone data set, which will not be linkable to anything else in the Secure Research Service, although we are exploring the possibility of making a linkable version available so that we could start linking it with other things, such as census, for instance, or education records. And we have some possible developments that we're already thinking of after we've got the initial data set in there. Some more granular data available, and also including education activities, if we can manage to do that. And if you can move on to the next slide. This is just another little bit of a plug. If you're interested in knowing what DWP's research interests are, these were most recently set out in our 2023 areas of research interest. We are looking to prepare an updated version fairly soon, but to be honest, most of the things that we are interested in now are things that we've been interested in for a number of years. There is also a cross-government areas of research interest database. So if you want to know who is interested in a particular topic, you do not have to know which department to look at. You can just look up the questions. And the last thing is just to say that if you've got any ideas about research with DWP, there is a an email address which you can contact. At which point I will hand over to Andrew for the interesting bit.
Thanks, Mike. Right, I'm going to take you a whistle-stop tour about how we create Rapid and what it's got in it. So next slide, please. I appreciate this has got a lot on it, and it's probably quite a small screen for a lot of people, but essentially this is the inputs, the process, and what you get out of it. So the top set of boxes, we take in all the data that we get from all of our admin systems, benefit systems, legacy and new systems. So some of those extracts that we get are weekly, some are monthly, some are 6 weekly. If we get a weekly extract, we look at all 53 weeks within the year to capture the right amount of money that is being paid to that person in that week. And essentially, we link all of this data, including some of the data that's now being devolved to Scotland, into something called our customer information system. So that's where we get all our demographic information about addresses and dates of birth, dates of death, all of that sort of information. And essentially, all this data is linked together so that you have one row per person per tax year. If you think of it as an Excel spreadsheet, you have one row and then you have a different column for each of the activities that we're looking at in Rapid. So, for example, for every benefit or every interaction that we take into Rapid, we would capture the total amount of money that is associated with that activity in the year, how many weeks that activity has been present in the year, something called end of month and during month indicators, which I'll show you how they work in a moment, but that tells you which months the particular activity has happened in. And we also capture, if it's things like a household benefit, who they were partnered with in each of those extracts that we've looked at, and we create relationship data. So if you look at the sort of third bar down where it says outputs, at the moment, we create 16 different data sets, one for each tax year from 2008-9 through to 23-24, and we'll be processing the 24-25 tax year in September. Each of those 100% data sets has got 86 million people in it. Now, obviously, our population is only about 66 million at the moment. So some of those people are alive, but not resident in the country at the moment. So how do we get rid of the people that we don't think are resident? And we use the presence of some of these activities to help filter out those people that we think are no longer here. Routinely, we create a 5% version of the data, just so that you can test code and run it quickly. Running data on 86 million records takes some time. And we also capture the relationships. So we capture the relationship in child benefit between the child and the main payee. And for all the other income-related benefits, income support, UC, pension credit, housing benefit, carers, state pension tax credits, we capture who person A is paired with and how long are they paired together and which months are they paired together. So for some people, you can generate a household. In terms of the outputs, one of our main outputs is children in low-income families, which generates that household link, looks at the income of all the people that are in that household, and then sets a measure of those families that we think are in poverty. So that's our official child poverty measure. It's also used by ONS, so it forms part of the basis of the official migration estimates, so it produces the GB estimates and the EU estimates, but it's also been used by ONS, Scottish Government and Northern Ireland to quality assure the census 2021. We use it for all sorts of other stuff in terms of pension credit take-up, looking at who looks as though they're entitled and not claiming, and then perhaps targeting particular areas. We use it for labour market stuff. And just recently, we've produced 4 of the measures for the new indices of multiple deprivation that will be published later this year. Creating this data we read in 7,800 different data sets. It's a massive job, and it's a massive data set. Next slide, please. So this is sort of the spheres of influence in terms of how much RAPID is now used. We share it with DFE, that feeds into the LEO model. It's used in the parent-pupil matching, which is then used for allocating school meal funding to schools. We share it with ONS for population and migration work. We're linking it with Ministry of Justice data to look at the outcomes of ex-offenders. How long do they stay on benefit when they come out of prison? The indices of multiple deprivation, we're using it for our own family resources transformation, and the data is linkable to the family resources survey. Next slide, please. So it's worth keeping in mind a few of these things. At the moment, while everybody on this call is in this data, RAPID is created on fully masked data. I can't find anybody. So I can't see name and I can't see full address. And I can't actually see your national insurance number either. So that brings with it some limitations. But we think the way we've processed it is as accurate as we can at the moment. Anybody that doesn't have a national insurance number will not be in the data. And that will affect certain groups of people, perhaps foreign students coming to the UK for education purposes that don't need a national insurance number. RAPID is really just a cleaned summary of all the data that we have available, rolled up into this annual view. It just makes the data far easier to look at. It's all processed in a generic way that makes the data more usable and more accessible without having to go through all the 7,000 individual data sets. It generates an income measure. Now that's an individual income measure, not a household income measure, but you can generate household income by using the relationship data for some families. And at the moment, we only use it for statistical purposes. It's important to say as well, this is not perfect. Admin data, by definition, is not perfect, but we think it's reasonably good. Next slide, please. So this is a quick whiz through how we pull the data together. Essentially, we take everybody with a national insurance number into the data set. That includes children. So children have a national insurance number. They just don't get to find out about it until they're age 16. But as part of the Child Benefit Award, they get a child reference number, which at 16 turns into a national insurance number. So as a filter to start with, we take anybody that died before 2008-9 out, not interested in them. So that removes some records. And as long as the person was alive from 2008-9 onwards, or was born after that date, their record is brought into RAPID. We calculate some key dates for them. So the tax year that they were born in, the tax year that they died in, the tax year that they would reach state pension age, taking into account the equalisation of pension age for men and women and the increase of pension age from 65 up to 68. We then link it to the migrant workers scan, which is an extract that captures all the information about non-British registrations for national insurance. And we capture all sorts of information around when did they register, when did they say that they arrived, what country have they come from, what was their nationality at the point that they registered. Unfortunately, what we don't get is any update to that information. So if somebody subsequently becomes a British national, we don't get to know about it. But what you can say is this person was non-British born, if you like. Next slide, please. So this basically shows the process of how we would generate the data. So the column in blue is a weekly extract. So we would go to 53 different weekly extracts and capture how long in that week was somebody on income support. And in the first week, we might say they were only on for 3 days and we paid them £50. But in the second, third and fourth week, they were on for 7 days and we paid them a different amount in those periods. What you see below that black line is what would appear in Rapid. So it would take all of that information and roll it up into an annual view. We then link it with things like the address information that will tell us whether they have an abroad address or not. And if they don't have an abroad address and they have an activity, we would say that they're probably resident. And then we would total up all the income from all of the activities that we see in Rapid. Next slide, please. So we talked about during the month and end of month indicators. So this sort of table shows you 2 periods of employment. 1st of February 2020 to the 6th of June 2020, and then an employment from the 1st of November onwards. What that variable would look like is underneath the table. It's a 12-character string, where the first character represents April, and the second character represents May. And if you've got an activity during the month at any point, that indicator will be 1. But if it's not current on the last day of the month, the indicator would be 0. So you'll see that there's a red 0 for June because that employment finished on the 6th of June, so wasn't there on the 30th. Next slide, please. So this is looking at universal credit, and rather than it being a binary yes or no, this now tells you they're on universal credit for 2 spells. The indicator works in the same way, in as much as it's 12 characters where the first character represents April, but this then tells you what the conditionality is for that universal credit claim. Next slide, please. Again, for disability benefits, we've repurposed these EOM and DTM indicators again, which tell you the level of disability, if you like. Are they on a high rate of disability? And what is the combination that they are on? Next slide, please. What these EOM and DTM indicators enable you to do is put a number of tax years together into a string, which means that you can either look at a consistent point in time, which is useful comparing it to published outputs, or you can split it in a different way to look at spells of a particular activity or a quarterly figure, or you could produce something that gives you a count monthly. Next slide, please. So there are some benefits to this. It's 100% data, so it enables you to look at activities over a huge period of time and at small populations or small groups of people. If you wanted to look at, for example, people with a particular disability condition, like a mental health condition, for example, you could look at that and you could look at it by a small geography. It's very easy to understand. It's well documented. We have good metadata. And because there is no linking to it, it's all in one Excel type, 1 row per person per tax year. It makes it very simple to understand. The EOM and DTM indicators enable you to split it into point in time or during the year, or looking at those monthly trends. And for some groups, it will enable household level data, but it won't enable you to do it for everybody. So if you're not on a household benefit, we have no way at the moment of putting people together. So it's not perfect. At the moment, it excludes education and training activities, although we've just got permission from DFE to include that. So the next version of the data that will be in the SRS will include some of those education activities. We don't apply any residency rules. So people that aren't active might look as though they're not resident at the moment. So as an example, my mother-in-law stopped work at 61 and has only just claimed a pension at 66, but didn't do anything in that intervening period to leave a footprint anywhere. So she might look as though she's not resident. It doesn't capture debt or housing costs or child maintenance or any other outgoings at the moment. And it doesn't capture anything about working patterns in terms of part-time, full-time. Next slide, please. So I'll show you some figures. I think we're all right time-wise, but I'll show you some outputs of what this data looks like. Next slide, please. So this is our population measure. Now, this scale starts at 50 million, it's worth saying. And what you'll see is from 2014 onwards, we have a reasonably good match with ONS population estimates, although we do count the population differently to the way ONS count their population. And before 2014, we are missing some self-employment data. So people that are only self-employed, because we don't have that data, will look as though they're not resident, even though they are in the data. So you could backcast some of that information, and indeed ONS do that when they look at the data for population measures. But it's worth just noting that the data isn't complete because it's missing a group of people because we didn't have a data extract for self-employment before 2013. Next slide, please. So this is our income measure by age group over time. And what you'll see is that the most recent tax year, which is 2023, you have this uptick of income, particularly for the pensioners. I mean, it affects the working age group as well, but you see this uptick for pensioners. And that was because inflation was at over 10%, and we increased our state pension by 10% in September 2024. Next slide, please. It's also worth saying that our income measure doesn't include, cold weather payments or winter fuel payments, or income from dividends and stocks, insurances, or self-invested personal pensions. It is primarily stuff that comes through PAYE, self-employment, or benefits. Next slide, thank you. Right, this is looking at children and families. And because children appear in the data, and you can link children to their main payee on child benefit, this gives you the ability to look at particular types of family. There was an article on the news that said, is the provision and cost of preschool childcare a barrier to work? And I thought, well, actually, you could probably do some analysis on that. Now, this data doesn't have anything in it about childcare, particularly, or nursery places or anything like that. But what it does tell you is where people are. So next slide, please. So this is our child benefit count, around 8 million, 7 million families, and about 13 million children. What you'll see is in 2021, you've got some additional records there. And those additional records are because in 2021, we got a new extract of child benefit, and that new extract included children and families that were part of a child benefit award where there wasn't a payment because of the high income cap. So they'd claim child benefit, they would get the national insurance protection for looking after children, but the child benefit wasn't actually in payment. Now you could actually backcast those children as well. So you could fill in some of the gaps if you wanted to, but we now have proper coverage of children and families, including those children and families that have claimed child benefit but aren't being paid because they're in a high income family. Next slide, please. So going back to that question about is having a preschool age child a barrier to work, this is looking at those families that have got a child under the age of 5 in 2021-22 and looking at by MSOA, where are they based? And we had 2.4 million families with at least one child under the age of 5 in 2021-22. 1.8 million of those families looked as though they'd got an employment record, or the main payee of child benefit had got an employment record. And 1.4 million of those looked as though they were in employment all year. So they're not a particular problem. They might be low income, but they're in employment. Next slide, please. This looks at the same set of people, have at least one child under the age of 5, but they've got no employment record and they're only appearing on a working age benefit. So that's 500,000 families. And this data enables you to look at where those families are. Now, if you look at the map on the right, that's Newcastle. That's roughly where I'm based now. And that squiggly line at the bottom is the River Tyne. That dark blue area is an area of high-rise council properties. It doesn't tell you anything about childcare, but it tells you we've got a high density of families with young children that are preschool age in that area. So it enables you to do this level of, you can go down to lower super output area if you want it with this data. Next slide, please. So this left 88,000 families that either had no employment record or no working age benefit. And this just shows where they are. So you can cut this data in a number of different ways. Now, these people must still be in receipt of child benefit. So they're not high income people, but they're obviously families that are perhaps, the child might be newly born. They might actually be on maternity or whatever. So it's just interesting that you can cut the data that way. Next slide, please. So this is just some time series charts that take you through from 2014-15, when we think our population measure is complete in RAPID, all the way through, and it looks at those people that are on an income related benefit. So if you press the next slide, this just plays through time. So this is men aged 18 to 59, England and Wales and London, and what it shows is through time where the density is of those people that are in low income related benefit areas. There are 2 areas on that map that stand out, and you'll see it in the employment rates as well. One is Birmingham and the other one is Bradford. And we think that some of that is to do with the ethnic makeup of those local authorities, where people culturally are more likely to stay at home and look after children than go out to work. Next slide, please. So this is the same income related benefit for women aged 18 to 59. And what you'll see is that the picture for women is very different to the picture for men. And again, those 2 dark areas there were Birmingham and Bradford. Next slide, please. So this is disability. So you can look at the disability in the same way. Next slide, please. So this is taking the disability for men 18 to 59 again through time. What you'll see is, as you go through, once you get to 2020 pandemic time, everything starts to go blue. South Wales particularly, all the ex-coal mining stuff in County Durham and steelworks in Humberside and stuff all goes blue. Next slide, please.
Andrew, just another minute, please. Thank you.
Yeah, I think I've nearly finished anyway. So yeah. Next slide, please. Carers. This is worth looking at. Next one. This is the care picture for men. Obviously, men don't care very much. But yeah, very low rates for, of care for men all the way through time. 2020. And I'll just do one more slide. There is an employment one as well, but so this is the care picture for women, which is very, very different to the care picture for men. Just fascinating stuff, really. You can play with this for hours, but I'll not do any more. I'll stop there. There's a couple on employment, but let's just leave it at that for now.
That's fantastic. Thank you, Andrew. I mean, I can certainly see the utility of this just as a standalone data set. And obviously then if ADR are able to facilitate future linkages, then I think that would open up a whole host of additional research areas that can be tapped in. I don't see any questions in the Q&A, but I imagine many questions will come once it's actually available. So it's fantastic also to see that you've invested in a lot of time in your data documentation. Can I just check from the other panelists, is there anything you'd like to come back to, Andrew, on that on? Holly.
Holly, you're on mute.
Yeah, I'd like to ask about prospects linking to the census. So just on your carers allowance example just now, we could link, those that self-identify as carers to those in receipt of carers allowance benefit, for example, if we had that linkage. So what are the prospects for linking to census data and indeed children's social care data?
I don't think there is going to be a linkable version this year. That whether we get a linkable version in subsequent years, I don't know. It's one of those things that we still have to work our way through. The carers element does give you the link between the carer and the caree, and it gives you the relationship as well. So you can tell whether it's a husband and wife or son and daughter, for example.
Yeah, but can I just in the census we'd have those that self-identify as being a carer, so we could look at whether the extent to which those people receive support with it.
Sorry, it's Graham. Can I just jump in? Can you hear me all right, Polly?
Yes.
Yeah, just checking I'd unmuted myself. Sorry, Graham Knox, DWP as well. The version we're making available in the SRS initially is going to be standalone. We are giving ONS for ONS's purposes a version with identifiers. We're working with ONS at the moment on what the future strategic plans are. So what should be our priorities for linking Rapid to other data sources? Now, that's not just DWP data. That's the whole of the integrated data service wrapper that ONS runs. So ONS have got to consider, as they get more and more admin data into the IDS/SRS, what's their plans for linking that up, whether it's through indexing data in the IDS and in theory you could create any linkage, or whether it's bespoke linking to link dataset A to dataset B. And at the moment, we're focusing on those strategic linkages of A to B. Census is one that has been suggested anyway. Certainly would benefit DWP for things like our poor ethnicity data that we don't really have good coverage on, and linking to census would improve that. So yeah, there are conversations happening. We're looking at summer in inverted commas for making a standalone version of Rapid available. I would imagine if we were to say take census as a priority data set and link Rapid to census, we'd probably be looking at maybe January 26 before that would be available. Just the amount of time it takes to do all the governance, the linkage is complicated. So yeah, probably at least another 6 months after standalone. But we're having those conversations with ONS. I'm sure ADR will be involved in those conversations as well to help decide what the priorities should be going forward.
Brilliant. Thank you, Graham, for the clarification, and thank you to all of our speakers. Yes, Karen?
Yeah, just one last point, Graham and Andrew and Mike. I mean, it was so exciting actually to hear that one, Rapid is available to answer substantive questions within the parameters of the standalone data set, but also the possibility of being able to quality assure other linkages, particularly around who's in the household. Now, I know there's some limitations to that, but that's a very exciting prospect going forward, the way in which potentially Rapid could be used to help other studies understand the quality of their linkages and things like false negatives, etc. Yeah. I just wanted to throw that comment in.
Thanks, Karen. So thanks again to everyone. for attending the event today, and also to our speakers. Grace is just going to quickly share a QR code for our evaluation. Please just spend a moment or so if you can, using the QR code to evaluate our event, just to help us improve our future events. And also you can join our community using the second QR on that slide. Please keep a lookout on our ADR microsite as well for information on our future events. And thank you again. Enjoy the sunshine this afternoon. Enjoy the rest of the day. Thank you. Bye-bye.
Bye all.